now to officially start our meeting, if you join me with the Pledge of Allegiance. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you, Pastor Tennant.
You're welcome.
Yeah.
And again, welcome to the June 24th Clermont County Board of Commissioners meeting. I'll call this meeting to order, and we'll start with our regular agenda. But we'll go ahead and ask on B, approval of regular session minutes for 6/17/2020. Board, you've had the minutes for 6/17 early, had the opportunity to review them. Have any questions or clarifications made or answered? Do I have a motion to approve the regular session minutes of 6/17/2020?
I move we approve the minutes.
I'll second.
It's been moved and received a second. Roll call, Holly.
Commissioner Humphrey,
Aye.
Commissioner Corcoran.
Yes.
Commissioner Painter.
Yes. I'm going to deviate from that agenda and move to I, County Staff Elected Official Discussion. Are there any staff or elected officials this morning that would like to have a discussion with the board? I understand Julianne Nesbitt is on with us, our health commissioner, and is going to give us an update on COVID-19 and the health of Clermont County. Julianne, thanks for being here this morning.
Good morning. Thank you all for having me. I just want to give a little update of where we're at. So in Clermont County, we are currently at 288 cases. We're holding at 6 deaths. We have 49 hospitalizations. We've had 221 individuals who've recovered. We have 61 active cases right now. So we are definitely seeing increases in cases, and part of that is because they have opened up testing. Testing is now available to everyone. So some of it is that, but some of it that we know from interviewing our cases and looking at contact tracing is really because people aren't quite being as vigilant with social distancing, and that's a concern for us. We want to make sure, we're not out of the woods yet. I know it's summer and everybody wants to be out and having fun, and we want people to be, we want them to be, visiting businesses, and we want to be able to open our schools, but we really have to continue to remain vigilant with it, and that includes, continuing with social distancing on it, wearing in masks, and when you're in public places, hand washing, sanitizing, those kind of core things that we've been doing all along, which have kept us, really in a pretty good situation. Particularly in Southwest Ohio, we are definitely seeing increases across the region. And it is concerning because we are seeing some increasing in our hospitalizations going up. The kind of age range is really, I think I may have mentioned the last time I was on that we were starting to see that younger population, kind of teens and 20s. What we've seen over the last couple of weeks is it's really the full kind of age range, so down into younger children, continuing to still be up in elderly, and certainly some of those high-risk individuals that we're really concerned about getting with it. One thing I wanted to mention on the testing, since it is open to really anyone at this point, is to just keep in mind that if you get tested and you are negative, that is a single point in time. That means you could be positive within a couple days from then. It depends on your exposure to individuals. Once you have been in contact with someone or been exposed to the virus, you can become symptomatic within 1 to 14 days. We do know there's a number of people who remain asymptomatic, so don't even know that they're carriers of it, but can still transfer that on to other individuals. So just keeping in mind with it, if you get a test and you're negative, it doesn't mean you're free and in the clear. You still have to kind of continue to remain vigilant so that we don't continue to spread throughout the community. So that is all I have, unless you have any additional questions.
Julianne, could you comment on just on the national side? I know that you're still very connected to the health commissioner here in the state of Ohio. I would imagine a lot of people who are watching have questions about what's going on in the national level and the upticks that have been seen in Texas and Florida. Just any comments on that?
I think it's really kind of similar. As economies have started to open and more people are out and about, you see a lot with kind of those travel destinations. So we've seen concerns with Florida, South Carolina, where their numbers are really starting to uptick. With that, it just kind of, you're bringing in people from all over and in all places. And so it's really, like I said, it kind of goes back, I think, at the national level even too. It really goes back to continuing to work on remaining vigilant with those practices that we've put in place to slow the spread so we can kind of continue to hold it there. Again, I think people need to remember that some of the reasons we're doing this is really to continue to protect our healthcare workers, to make sure that we have capacity in our hospitals on it, that we have enough ICU beds and ventilators. And while we're seeing upticks in cases, we are seeing increased hospitalizations. We're not in a horrible place yet. I don't want to give that impression at all. But we really need to keep our eye on it and just continue with those practices. I was reading some information where we're hopeful if I think all ducks are in a row and everything is aligned, we might have some vaccine by the end of the year. And that'll certainly, help if, as we kind of move forward, because the more individuals within the community who are either vaccinated or, we gain herd immunity through either getting the vaccine or being vaccinated from the vaccine, it particularly helps our very vulnerable populations.
And then I would just ask you about, I think that a lot of people ask the questions, do we currently have people who are recovering or being treated for COVID that actually occupy our hospitals? And I know that you get a hospital report for here in Clermont County, and I know that, there's information that you can share and there's information that you can't. So I'm not asking you to share anything you can't. Could you just kind of touch on that so that just the general people watching know what's really going on?
Yeah, we do have residents who are hospitalized currently on it. So, and I do know particularly across the region, hospital, we're seeing increases in admissions. We are seeing increases in ICU bed capacity. I did, we have a partner meeting that was this morning. I reached out because Mercy was not able to be on that. They actually have a very large federal inspection this week. So I did reach out to them just to find out what was going on, kind of across the street from us. And they did indicate that actually for Clermont County, they are not seeing increases, but they are starting to see within other areas across the region. And again, that's our concern. I think many people were aware there were areas in Hamilton County, Warren County, Montgomery, and a few other places that were kind of pointed out by the governor last week. I think it's just in general, you're starting to see Southwest in particular. We currently have the highest reproductive value in the state. So that's that kind of ongoing transmission of how one person spreads to another. We'll be interested to see kind of what those numbers will be this week. I'm not going to be surprised that they may go up on it. There's lots of calculations that go into those numbers.
Okay. Anything else, board? Anything?
No.
Okay. Well, Julianne, thanks so much for being with us here this morning, and
Thanks, Julianne.
continue to do your job. Before I move on any further, I just wanted to make sure that everyone knows that Commissioner Humphrey is joining us from a remote location there today. He's on the virtual screen here in front of us. He is not in attendance here at the Clermont County Board of Commissioners, located at 101 East Main Street in Batavia. Ed, glad you're on there. Just wanted to point that out. Tom, any other updates this morning?
No, sir.
Okay. Then I would move on with our agenda. In C, we have a proclamation this morning designating Thursday, June 25th, 2020 as Russell Lee Simmons Day in Clermont County, Ohio. So I'll read this proclamation. For you, those of you who do not know, and maybe who are old enough to know, Russell Lee Simmons was the Clermont County Clerk of Common Pleas Court here in Clermont County for 26 years. He unfortunately passed away June the 9th. He He served this county for 26 years in that position. So this morning I have a proclamation designating June 25th, 2020 as Russell Simmons Day here in Clermont County, Ohio. Whereas Russell Simmons was a resident of Point Pleasant, Ohio, and he was the Clermont County Clerk of Common Pleas Court for 26 years. Russell took office January 1, 1969, and he left office in 1995 after 26 years of service. Whereas Russell Lee Simmons served his country in the United States Navy for 4 years and was a Korean War veteran. Furthermore, Mr. Simmons was a 33-degree Mason with the Moscow Lodge number 122, where he was a member for 70 years and served as the master for numerous terms. He also served as a Deputy Grand Master of the 6th Masonic District. He was a member of the Scottish Rite, the Syrian Shrine, and the Order of the Eastern Star. And whereas Russell Lee Simmons was a lifelong member of the American Legion, the VFW, the Royal Order of Jesters, 40 and 8 Club, Sons of American Revolution, and was a Kentucky colonel. He was a lifetime member of the Methodist faith. And whereas the Board of Clermont County Commissioners wishes to recognize and honor the late Russell Lee Simmons for his contribution and service to our country, to our county, our state, and our country. And now, therefore, we, the Board of Clermont County Commissioners, do hereby proclaim Thursday, June 25th, 2020, as Russell Lee Simmons Day in Clermont County, Ohio, and that we order the flags of the Clermont County government buildings to be flown at half-staff from sunrise to sunset on June 25th, 2020. This proclamation is signed by David L. Painter, President, Edwin H. Humphrey, Vice President, and Claire B. Corcoran, member. Thanks, Mr. Simmons, for your service to Clermont County. And thanks to the Simmons family for letting us borrow him for those 26 years. Board members, any comments?
No, well done.
Ed, I know you were here.
Yeah, he was a good man. Saw him in Clermont County maybe 10 years ago. Good man.
Russell was the father of many daughters. And I'll just point out one, although I believe he had 6. Is that right, Ed? I believe Russell had 6 daughters. Five daughters. I'm sorry that. To Peggy, I know you contacted the Clermont County Board of Commissioners in honor of your family. We will lower the flag some more for Russell's service here to Clermont County. I'll move to our next item. We have a presentation from Karen Shearer, the Executive Director of Clermont County Mental Health and Recovery Board, from Alcohol, Drug Addiction, and Mental Health Services Tax Levy. Karen, thanks for being here this morning.
Thank you, Commissioner. Thank you also, Commissioner Corcoran, for giving me the chance to talk with you. I wanted to start out with talking a little bit about what we actually do and what our services are and why we need our local levy so much. I think people have been hearing a lot, especially with COVID-19, about how much need there is, not only in our county, but in the state and across the country, for mental health and drug and alcohol services. In a normal time, estimates are saying that 1 in 5 people will experience a mental health issue at any given time in a year, and 1 in 10 will be experiencing substance use disorders. That number went up because of the opioid epidemic to 1 in 7. And for both of those, we're now hearing those numbers could get much higher going forward because of just what social isolation and the anxiety about COVID-19 and such have done. So you see just with estimates there, those are the number of people that might be necessary to get services in a year. All of the services are not gotten through us. There are other agencies, but we are the primary source of mental health and substance abuse services, and we are also the one that's a safety net for those who don't have the means to get it anywhere else. this is not moving. Oh, there we go. So why do we need services? What are some of the things that lead to that? Clearly, suicides is an issue that we want to prevent. We're hearing more about that too with the COVID-19. We have gotten the suicide numbers down in our county, but they're not as low as we would like, and what we really want is zero. Youth needs and school-based services are a critical thing that we provide. And again, I think that's going to be another area we're going to see a real increase next year, having talked to superintendents around the county. They're all concerned about what's going to happen as the kids come back to school, when they're able to come back for school. We are the lifeline, really, for those with severe mental disabilities or severe mental illness. We have to provide the services for them. A big service that we provide is the crisis hotline and mobile crisis. Mobile crisis allows clinicians to go out to a scene, to a home, when there is a mental health situation, sometimes called by law enforcement, other times by a family themselves. We need to do prevention to stop the growth of mental illness and to help people deal with the issues they have. And our work with criminal justice is especially important. People have heard a lot about people with mental illness ending up in jails and prisons, and making sure that we're working with law enforcement in the jail to keep those numbers down. On the substance use side, I think everyone is very aware of the opioid epidemic we were in. We have gotten a little bit of control over that in our county. The numbers are down, but we're beginning to see a rise again because of COVID-19. We're even seeing a rise in overdoses. Meth is back on the scene, and we have never seen really a decrease in the use of alcohol and other drugs, even when opioids and meth are high. In fact, you will hear too, across the country, the use of alcohol or misuse of alcohol is up, again, connected with COVID-19. For those who do have an opioid disorder, Medicaid-assisted treatment is the gold standard of treatment. And so we do have that available, but it is costly and it takes a long time. We want to prevent overdoses, and so providing Narcan to the community and to others to make sure police and everyone else have that available is important. And again, as always, it's prevention. It's trying to work with young people, young adults, to get them to not use drugs in the first place. So. And then there is a lot of confusion sometimes about our system and why we have to pay for people to have services. People know about the Affordable Care Act. They know about Medicaid expansion, and there seems to be some idea that everybody has a means to pay, and that is not true. Not everybody does qualify for Medicaid. With expansion, a lot more people did, but there are still people above that list, and people who then are in that in-between stage. They don't have enough, they don't have insurance at work, and they are over the financial limits for Medicaid. And many people who have insurance have high deductible plans and come in and can't afford to pay those high deductibles. People lose Medicaid because they don't provide required information, or they don't do the things that they're supposed to do. We do have benefit specialists to help to keep people on Medicaid, but while people are off Medicaid, we have to help out. We don't want services to end. There are new services that were added and continue to be added that the board pays for, and the most recent is telehealth, which was absolutely necessary for COVID-19. What the board has decided is that whatever services in Medicaid are allowable and what their rates are, that is what we mimic. So we pay the exact same thing for the agencies. But we also pay for things that that Medicaid does not pay for. Things like recovery housing and employment services. Some of the things that are not covered by Medicaid. So for everybody, we have to help with those. Again, with unemployment, many people have lost health insurance but do not yet qualify for Medicaid. And we are always under the concern that the ACA could be reduced or terminated. Same thing with Medicaid. So, and especially with the financial situation of our state and the country right now, we are concerned about that. And again, we never want lack of funds to prevent somebody from getting the services they need. So that's why our services are critical. This is our board's financial projection. 2020 is the current year we are in, which ends June 20th. We are in a state fiscal year. And 2021 starts July 1st. We have not closed out our year, obviously, yet, so those are projections. You will see that starting in 2019, we are spending more than we are bringing in. Our board has had a policy to try to maintain, to not spend more than our revenues, but when we have people needing services, it's absolutely essential. And in those years, had we stuck to that, we would have actually had to close down services probably in May. We cannot do that to the people of this community. So we will spend what we have to spend to keep the doors open. Oops. I think I lost a few here. Oh, thank you. Okay, thank you. I also wanted to make sure that you were aware that besides the money that we get from state and federal government and our levy, that we don't sit back and just wait for the dollars to be handed to us. We are very aggressive in trying to locate other sources of funding. There are funds that are coming to our region from the state for the 8 boards in what they consider Southwest Ohio. So that has helped us with services, and so that you know, I am the lead person for that collaborative. So I have a lot to do with how those dollars are allocated. Local funds, these are just a couple of examples. We get money that's called IDAT, or Indigent Driver Alcohol Treatment Funds, from municipal court that helps us provide services to those with alcohol addiction. We have had for many, many years a co-funding situation with CPS that helped fund services. That is ending going into next year, but it has been a good source of funding for us. And because of our collaboration with Family and Children First, they have pooled funds that we help contribute to that also helps to provide services. Suicide prevention that they do, we actually do in tandem. We started that a couple years ago. So we look at all the needs and kind of share the costs. You will see a list of grants. I won't go through all of them, but those are all current grants that we have. And we are always looking for opportunities to find additional funding. The difficult thing about grants is that they end, and then you have to come up with the money to sustain them. But I'm really proud, pretty much every grant we have ever received, we have found a way to sustain. And we will keep doing that and bring additional funding into the county. This is a list of the services. Again, I won't go through everything, but for those who have mental illness and are adults, you can see the wide range of services that we provide. Some of them are obvious services that you're used to, like counseling and diagnostic assessment, but you also see things like supported employment to make sure that people are able to get a job and not have to rely on public assistance, helping them with housing, helping, as I had mentioned already, the benefit specialist to make sure people stay on the public assistance that they are using. And the last one, the jail linkage program, is one of the things I think we're most proudest of. We did get a grant for that a number of years ago, and that has been a very productive collaboration with the jail. They could not be better partners, and it has brought many more people into our system and out of the criminal justice system. These are the lists for children. Again, pretty much the typical things you would expect. State treatment is in lieu of school for those who are very seriously mentally ill and need to have some schooling, but also need to be in a protective environment where they can get their mental health needs addressed. And as I mentioned, school-based. School-based is where we put a lot of our funding. That's where kids are, and our collaboration with schools has provided a great way to get access to children and their families to meet needs. On the alcohol and drug side, a lot going on, obviously, and that's because there are a lot of needs, a lot of issues. And again, as I had already mentioned, things like vocational and other services that are not necessarily thought of as treatment, but that are important to get people back to their recovery and to have them move on with their lives. We also have very specific programs for adolescents. It is the 7 Challenges program that we do, which is an evidence-based practice. We have been doing that for years and getting really good results. And then the newest services that we have that are not considered treatment necessarily, but are critical to people's recovery, are recovery housing. We have a male and a woman's house, and we are in the process of working with private investors to maybe get 2 more. So we're pretty excited about that. And our recovery coaches, the peers, who have really been game changers in our system in working with people trying to achieve recovery. Besides those services, we do other things. I've already mentioned our hotline and mobile crisis. We oversee the opiate task force. We are the ones who oversee crisis intervention training for police, which is getting a lot of attention lately. And we give mini grants out to other organizations in the county that do not contract with us to help them do some of the really good grassroots work that's absolutely necessary. And NAMI is the National Alliance for Mentally Ill. They do all kinds of support groups for families and programs for consumers as well that really provides that needed support. And without our contribution to them, they would not be able to do the work they're doing in Clermont. Here's the number of people that we're serving. These are estimates from where I'm at this point in time. But we have a lot of people served. These are the people that are served through our dollars. When you really look at how many people are served with insurance and Medicaid and such, those numbers are much higher. They're almost double, quite honestly. So a lot of people are impacted and impacted positively by our system. Here's some of the outcomes we've achieved. I don't want anyone to think that we just simply fund agencies and just let things go. We want to make sure what we're doing and what we're paying for is working and people are getting better. A couple things that I will mention. There are currently 499 people receiving Medicaid-assisted treatment. Those are people that were addicted to opioids who are now in recovery. Many of them working, living on their own, have their own families back again, and doing really well. When you see the number of people that we have in group homes, there are only 12 out of almost 1,500 clients in our system. I think any other county would be hard-pressed to meet that number. Most people have a lot of people living in group home type residential situations. Our belief is people need to have recovery and live on their own and in the community or with family. And we work very hard to do that. So that's a number we're really proud of. We are also dealing with homeless individuals. It's kind of a quiet problem here in Clermont. It's not as obvious as you might see in some of the big cities, but they're there. And many of them have mental illness or substance use problems. And we have a grant program that helps us with that. And then, as I mentioned before, the jail linkage program, you can see how many people have been touched just in 1 year, in calendar year 19. And the fact that we got so many people into treatment and 60% stayed in treatment, those were all people primarily that did not have treatment before that. They were cycling in and out of criminal justice. And the recidivism rate is 27. We'd like that to be lower, but that's actually pretty good when you really look at the people we've been working with and our ability to keep them in treatment. Everybody always wants to know how much money goes to services and what are we doing in terms of administrative costs. Our administrative overhead is 8%. And I apologize, there is an error there that should be 4 to 5%, not 2% signs. For many, many years, that's where we range. The only reason that it's higher now is that we have less money than we used to have. We've had a lot of cuts. 10 years ago, we had 7 board staff. The last time our levy was on the ballot in 15, we had 5. We're down to 4. The reason we've done that is we haven't replaced people retiring, and the board's perspective is that every dollar we can goes out to services. So we're mean and lean. We do a lot of work, and we have a very small staff. And I also wanted to mention the board claims system. We used to contract with another board to do all of our claims billing, which was rather expensive. A new system was designed when the state system was ending. We were the first ones in the state to do it, which was a real risk for us. Now all but a couple boards in the state are using that GOSH system. And we took it in-house. So we are doing it on our own, even with only the 4 staff. So that was a tremendous savings in dollars that we were able to put into services. So the main reason I am here is that we do have a 5-year levy. In 2015, we renewed our 0.5 mil levy and also asked for a 0.25 increase, which was approved by the voters. So we now have a 0.75 levy, and it will be expiring. And our board, at its January meeting, approved that they wanted to ask for a renewal to be put on the ballot in November 2020. And that's what I had sent to you as commissioners and prompted this meeting. That's what we're here to ask. We really think, even despite everything going on around us with COVID-19 and such, that we will be successful with this levy. We feel that we have a lot of community support. As I mentioned, 5 years ago, we got an increase. It was the first increase that we were ever successful in getting passed since the levy began in 1980. So I think that really showed an understanding of the community, especially because of the opioid epidemic, what we were doing and how necessary our services are. We work with so many partners. I listed a few there, but I think we have great support among all of our partners and stakeholders for the levy. That is the projected amount of money that we would be getting in tax year 19. I wanted to let you know that our levy is now 50% of our funding. Years and years ago, it was a very small part. It was maybe 10%. But as state and federal funds have decreased, the levy has become more and more essential to us. So without that levy, our services would be cut in half. And And I don't think anyone in this community would do well with that. We also think we're a pretty good bang for the buck. The number everybody always uses for the 100,000 rate home, it's only a little under $21 per year. And you see the rates per the more expensive homes. But for what we provide and what's able to be given to the people in this community, we feel that we're an excellent bargain and worth that investment. So that's it. If you have any questions, I'd be happy to answer them.
I have a thought. When you talk about the board, you're really talking about a mental health and recovery board, not the Board of County Commissioners.
That is correct.
Can you tell us who's on your mental health and recovery board?
Certainly. We are governed by a volunteer board of directors. It has 14 members. 8 of them are appointed by the county commissioners, and 6 are appointed by the state department we relate to, the Ohio Department of Alcohol and Drug Addiction Services. And all of those people have some interest in mental health and or addiction services. They may be family members, consumers, professionals, or advocates for those services. So I think we actually have an excellent board right now. We have 14 members. We're at full capacity. And they meet monthly with us, and then additionally as necessary to actually make the decisions about the funding based on the input we give them as staff.
Very good, thank you.
Mm-hmm.
Another thought or question is, when you talk about the collaboration with the jail, can you talk a little bit more about that? I know that's a new thing that we started a few years ago, and it really is good that we get in the jail and talk to people and understand their mental health issues and are able to connect them with services. Can you talk a little about that? I guess I've just done it, but.
Certainly, Commissioner, and you were instrumental in all of that because, as you remember, you and I were at a NACO conference when we learned about the Stepping Up program, which is a national program to really look at those with mental illness in the jails and to figure out ways to keep people out of the jail. And if they get in jail, how to make sure that they are connected with services when they come out. And that was something that we were asked to look into by the county commissioners, and we did. And as I mentioned, jail administration could not be better partners. We have people in their screening. We have someone who works full-time as a screener in the jail. And then we have staff from our adult mental health agency actually in there to meet and do assessments, to plan for discharge and make sure people get hooked up as soon as they are released. I think we also provide a service to the jail to be able to answer some of their questions about specific inmates, issues that they're having in the jail, so that we can help to address those so they don't get out of hand in the jail. And as I said, it's been a great partnership. I think they have been incredibly accommodating to us. And one of the grants that we are waiting to hear about is a federal grant to be able to expand the linkage program to also deal with those with addiction. Those are being recognized in the jail by our screening and assessments, but we haven't had a program in place to deal with that. So we are working on that as well.
And the last thing is CIT. Can you tell us what those letters stand for? And how many police officers have been trained? I know that there's a concern that officers do not recognize mental health problems, and we've been working on that. So can you talk a little about that?
We have. It's been almost 10 years, I believe, since we have started the crisis intervention training for police, that's CIT. We have had great support from law enforcement in this community. It's almost 90% of the officers currently are trained, and that number fluctuates a little bit as people leave and new people come on. But we try to do those trainings at least once, if not twice a year. And we have been very impressed with the ability of our local law enforcement to learn some skills, to really understand a little bit better about mental illness. But we don't want them to be social workers. This is not about training them to be social workers. It's training them to identify when someone may be having a mental health issue and maybe de-escalate a situation, approach it differently, or if it's beyond their ability to deal with, to call mobile crisis and have someone with that expertise be there. And my mobile crisis program works very closely with law enforcement to make sure that they can support them in any situation that they find that they need. So again, I think it's great partners in this community, people who really care. And law enforcement is, in this county, I think, excellent. They do care. They work with us really well. Our Sheriff's Department was one of the first in the state, if not the country, to give out Narcan and to carry Narcan. And in the words of former Sheriff Rodenberg, their job is to save lives, and that's what they're there for. And that has certainly been continued by Sheriff Leahy. So they are great partners with us, and they really care and want to get people the help they need. So it's been very valuable, and we've gotten a lot of people into recovery because of their work.
Excellent.
And Karen, my hat's off to the whole board there. I mean, mental health and people's awareness of mental illness has changed, drastically in Clermont County, and it is something now that people can talk about and be out front about and can seek help for, and it's well communicated so that people have options available to them.
Exactly.
And they should pursue those options,
Exactly.
Just like with anything else in your body, obviously your mental wellness and your mental health is definitely a big part of your overall wellness, particularly. One of the things just to talk about is you touched on mental illness, and you've talked on the ability to be able to stretch into the jails and to be able to diagnose people who have codependency. Just kind of talk about, just for a second, what the future vision of that looks like. I mean, I know that you're in the middle of it right now, but really the path to that is to assure that people who the reason that they can't follow the rules in society because they're impacted by mental health issues actually receive that help before it becomes a jail issue. Could you just talk about that a second?
Sure. That's, I think, one of the gaps in our system right now. It's been identified by many people. You've been part of some of the planning programs we've brought into the community to do that. What we would really like to have in the next couple years, and we are working on it, is a crisis stabilization center. Because quite honestly, right now, if police encounter a situation and the person cannot be at home, they're causing a problem, there really is only two places that they can go, the hospital or jail. And in many cases, they don't meet criteria for hospital. And so they end up in the jail. Our goal would be we wouldn't even need a linkage program in the jail because nobody with mainly in there for mental illness would be in there. Obviously, if they commit a serious crime, that's a different story. But so many people get in there because they're disturbing someone or acting inappropriately or causing problems. And again, it's because of their mental illness, not because of criminal activity or behavior or thoughts. So we are going to continue to work on that. Right now, we are, focusing on the jail and making sure people who are in there with mental illness get the help they need and don't go back. So we end that cycle, the circular road there that people are on. But we have plans moving forward, and we have, I think, support from many people to move in that direction, and that's something we would like to see, and I would like to see before I retire and move on to other things. So we are always working on that. So, and again, a lot of it is about people wanting to reach out for help, as you mentioned. And I'll take this opportunity to say all of our services continued through this entire process. We're doing telehealth by phone or video as well as in person, and more in person is happening now, but we're still using telehealth a lot. And people can call 528-SAVE, S-A-V-E, 24/7 for help. And even if you just need somebody to talk to or you have questions, they're there all the time. Reach out and ask for help because that's the best way. And if you know somebody else who needs help, you can also reach out, find out if you can do anything to get that person help.
And just to talk about the levy specifics, your request is to continue with the current levy that's there at .75 mils. This is a renewal, not an increase. You're not asking for an increase in the levy at all.
No.
And when would you project that this levy would come up on the ballot?
We were hoping for November, this
Okay.
coming November of 2020,
Okay.
to make sure there is no, we need the stability to know we still have that levy and we can be planning for the future knowing that it's still going to be in place for 5 more years. Even though collections are a year after, it's knowing that and trying to plan ahead for what we're doing.
Okay. Any other questions for Karen this morning?
Thank you, Karen, for all you do and for your entire board. I know I've got to do the one-on-one with you guys through the Family and Children First and even expanding to the Coalition Against Drugs and all that. I think your numbers will probably even increase more as children go back to school. due to the history we've had over the past few months, increase of alcohol and drugs. I mean, it's becoming pretty apparent, and we haven't really had access to know how many children really have been traumatized. And your school-based programs, I think, are wonderful. Thank you for all you do.
And again, we wouldn't do it without our partners. I think this is a great county for collaboration, and I will thank both of you and Ed as well. We've always had great collaboration and support from the county commissioners, and that means a lot. It sets the stage for everybody else, so we do appreciate it.
And to your board, too.
Right.
I know they work hard and they're dedicated.
Yeah, well, thank you. Thank you very much.
Thanks for being here.
All right.
Thank you.
Tom, any other presentations this morning?
No, sir.
Then I will go to E for the consent agenda. Board, a consent agenda has been prepared for you. I know you've had it early, had an opportunity to review it. Are there any items that need to be removed from the consent agenda for further conversation or discussion?
None?
Hearing none, I would ask for a motion to approve the consent agenda as presented.
I'll make the motion.
Is that muted?
Second.
It's been moved and we've received a second. Roll call, Holly.
Commissioner Corcoran.
Yes.
Commissioner Humphrey.
Aye.
Commissioner Painter.
Yes. And I'd move on to the non-consent agenda. Non-consent agenda starts on page 4 with item number 8. Recommendations, the Board of County Commissioners adopt resolution number 110-20 resolving to approve payment of vendors in the total amount of $2,722,636.83 as set forth in the BCC approval invoice report for checks dated June 24, 2020, BCC directed prepaid invoice report, or the procurement card transaction report as presented by the county auditor on June 22, 2020, and further authorizing the county auditor to issue warrants for the same pursuant to section 319.16 of the Ohio Revised Code. Do I have a motion to pay the bills?
I'll make the motion.
I'll second.
Been moved and received a second. Roll call, Holly.
Commissioner Corcoran.
Yes.
Commissioner Humphrey.
Aye.
Commissioner Painter.
Yes. Item number 9.
Good morning.
Morning.
Item number 9 on the agenda this morning, John Cascade, Director of the Department of Public Safety Services. My recommendation was concurrence with Thomas J. Eigel, County Administrator, to authorize David L. Painter, President of the Board of County Commissioners, or in his absence, any member of the Board of County Commissioners, to execute service agreement USC 00005269 by and between the Board of County Commissioners and Motorola Solutions for the provisions of dispatch services, on-site infrastructure response, technical support, infrastructure repair services as outlined in the statement of work for the county's paging and microwave systems for a total contract amount not to exceed $118,592 effective June 1st, 2020 through May 31st, 2025, pursuant to and in compliance with the terms and conditions set forth therein, and contingent upon the release of required purchase order in concert with requisition number 00003308-00, dated May 28, 2020, relative to thereto. And I'd just like to take a minute to explain what this is, if it's okay.
Fine.
When we say the county's paging, what we're talking about, this is the US VHF paging for the fire departments, the little monitor pagers they carry when we set off the tone. That's what this is for. That sets off all those tones. We have several paging sites throughout the county. And the microwave system, that is the redundant microwave system that ties all 11 county radio sites together and keeps them synchronized and working perfectly.
Okay. Board, you've heard the reading of item number 9. Do I have a motion for approval?
I'll make that motion.
A second.
Moved and received a second. Any further conversation, discussion? Roll call, Holly.
Commissioner Humphrey.
Aye.
Commissioner Corcoran.
Yes.
Commissioner Painter.
Yes. Thanks, John. Item number 10.
Thank you.
Good morning, I'm Lyle Bloom, Director with the Water Resources Department, and item number 10 is a recommendation
To authorize David L. Painter, President of the Board of County Commissioners, to execute 2 letters of intent to meet conditions for grant and loan funding to the U.S. Department of Agriculture, Rural Development out of Hillsborough, Ohio, for grant funding in the amount of $2 million and loan funding in the amount of $4,218,000 for a total amount of $6,218,000. This is for project number 6402-60116 relative to the Newtonsville Area Collection System Assessment Project, and for grant funding in the amount of $1 million and loan funding in the amount of $4 million for a total amount of $5 million. And this is for project number 6402-60117 relative to the Newtonsville Wastewater Treatment Project located in Wayne Township, pursuant to and in compliance with the terms and conditions set forth therein and in concert with the preliminary applications submitted for federal assistance through USDA Rural Development. So in March of 2016, the board signed a draft letter of conditions for the entire project. And then USDA came back and suggested that we separate the 2 projects and we could apply for additional grant funds. And then on April 29th of 2020, the board signed the second draft letter of conditions, which was just for the wastewater treatment plant portion of the project. So these are the final letter of conditions for the 2 projects, which will assist with funding for the Newtonsville Area Assessment Project.
Board, you've heard the reading of item number 10. Do I have a motion for approval?
I'll make the motion.
Second.
Been moved and received a second. Any further conversation or discussion? Roll call, Holly.
Commissioner Corcoran?
Yes.
Commissioner Humphrey?
Aye.
Commissioner Painter?
Yes. Item number 11.
Item number 11 is a recommendation to adopt resolution number 111-20, resolving to determine to make improvements relative to the construction, operation, and maintenance of the Miamiville Area Water Main Replacement Project located in Miami Township, and designated as project number 6401-60165, in conformance with the detailed plan specifications and estimates of cost and financing, is herein ratified and confirmed, all of which shall be paid from one or more of any combination of the Waterworks Capital Improvement Fund, any portion of any federal or state grant or loan should such become available, and or by the issuance of notes or bonds pursuant to section 133.0 of the Ohio Revised Code, and payable from revenues derived from water rates and charges levied for the operation of the Clermont County Waterworks System, and subsequent thereto to approve the request to advertise for bids for the project pursuant to the plans and specifications, and to authorize the clerk of the board to place a legal notice in a newspaper of general circulation on Thursday, July 2nd, 2020, schedule a non-mandatory pre-bid meeting on Thursday, July 23rd, 2020 at 10 a.m. with bids to be received until 2 o'clock p.m. local time on Thursday, July 30th, 2020. In the Office of Board of County Commissioners, 101 East Main Street, where they will be publicly open or read aloud shortly thereafter, and the legal notice will also be posted on the county's website. So this project involves the replacement of almost 3,000 feet of cast iron water main that was originally installed in 1959. The engineer's estimate for the project is $704,000.
Board, you've heard the reading of item number 11. Do I have a motion for approval?
So moved.
A second.
Been moved and received a second. Any further conversation or discussion? Roll call, Holly.
Commissioner Humphrey?
Aye.
Commissioner Corcoran?
Yes.
Commissioner Painter?
Yes. Thanks, Lyle.
Thank you.
Item number 12.
Morning.
Morning.
Item number 13, on the recommendation of D. Vincent Ferris, prosecuting attorney, with the concurrence of Thomas J. Igo, County Administrator, to acknowledge the electronic filing of the 2020-2021 Victims of Crime Act, State Victims Assistance Act, grant application for funding from the State of Ohio Office of the Attorney General for the continuation of the Advocate Program to provide extend victim advocate services to the prosecuting attorney in the amount of $121,706.60 with the required local cash match in the amount of $30,426.65 to be provided from the 2020-2021 annual appropriations for the prosecuting attorney for a total VOCA program amount of $152,133.25 and an amount of $6,586 for the SVAA grant with no local match required therefore, for a total amount of $158,719.25 for the Advocate Program for the period of October 1st, 2020 through September 30th, 2021, pursuant to and in compliance with the terms and conditions set forth therein.
Board, you've heard the reading of item number 12. Do I have a motion for approval?
I'll make the motion.
I'll second, but I think that was item 13, well, it's 13 on my list, but it could be that I have a whole list.
Item 12.
Item 12.
It is item 12.
Item 12.
Sorry.
Second.
Okay. It's been moved and received a second. Any further conversation or discussion? Roll call, Holly.
Commissioner Corcoran?
Yes.
Commissioner Humphrey?
Aye.
Commissioner Painter?
Yes. Thanks.
Thank you.
Thank you.
Item number 13.
Morning.
Morning, Sherry.
Sherry Smar, Community and Economic Development. I have a recommendation of myself, Department of Community and Economic Development, with the concurrence of Greg Bickford, Assistant County Administrator, to award the bid for project number 2018-02 relative to the Tate Township Fire Department Parking Lot Improvements Project in concert with the Clermont County Community Development Block Grant Program for fiscal year 2018 pursuant to the plans and specifications to John P. Tumlin and Sons, located at 10848 Sand Run Road, Harrison, Ohio 45030, for the lowest and best bid received on May 7th, 2020, in the total amount of $124,181, and to execute the contract relative thereto, with said services to commence upon issuance of a written notice to proceed from the Department of Community and Economic Development, and to be completed by December 31st, 2021, pursuant to and in compliance with the terms and conditions specified therein, and an award of bid therefore, and contingent upon the release of the purchase order.
Board, you've heard the reading of item number 13. Do I have a motion for approval?
So moved.
A second.
Been moved and received a second. Any further conversation or discussion? Roll call, Holly.
Commissioner Humphrey?
Aye.
Commissioner Corcoran?
Yes.
Commissioner Painter?
Yes.
Thank you.
Thank you, Sherry. Item number 14.
Commissioners, item 14 is the resolution we discussed last week a little bit. We were going to add that to the agenda. It's for House Bill 481, and we held on that because the governor had not signed the legislation, but he did so last Friday. So this resolution is required by that legislation in order to receive those federal funds. So this is a recommendation to adopt resolution number 112-20, resolving to fulfill the requirements of House Bill 481 for the passage of a resolution in order to receive and expend federal funds under Section 5001 of the Coronavirus Aid, Relief, and Economic Security Act.
Board, you've heard the reading of item number 14. Do I have a motion for approval?
I'll make the motion.
Second.
Been moved and received a second. Any further conversation or discussion? Roll call, Holly.
Commissioner Corcoran?
Yes.
Commissioner Humphrey?
Aye.
Commissioner Painter?
Yes. And Tom, I understand that this money will flow through Clermont County through the local government fund, but that municipalities and lower entities also have to pass a resolution like
Yes, sir.
this to be able to receive those funds.
Yeah, so if we follow the formula that we've had in the past, we'll receive about, the county will receive about 1.2 million. But yeah, you're correct. All the local political jurisdictions have to pass their own resolution.
Okay.
So what we can do is we can send out our resolution to those political subdivisions after the meeting as a template for them to use to pass their own resolution.
Okay.
And just keep in mind, all the funds have to be expended by October 15th. And then if they're not, they come back to the county, go back into the fund, and then they're redistributed. But everything has to be spent by December, the end of December.
And this $1.2 million that will be distributed per the local government fund, these monies can be used for expenditures such as?
Let me go through a list here,
Okay.
just to make sure, because there is some discussion about the difficulty in understanding exactly what the funds can be used for. So basically, they're necessary expenditures incurred due to the public health emergency with respect to the coronavirus disease 2019, and they can't be accounted for in your budget. And they were incurred during the period that begins on March 1st, 2020 and ends on December 30th, 2020. So they gave a few examples. Some are expenses related to acquisition and distribution of PPE, expenses for disinfection and sanitizing public areas, technology improvements, which would be, what we're doing here with the Zoom licenses, some hardware, software, any cameras that you use, and then costs and supplies related to employees working from home. So if we provided laptops or Zoom capability for employees to work from home. Now, there's some other things that we have a finance committee that we've set up. They're looking through all the act to ensure. There's talk about reimbursement for public safety salaries, but we're not real sure about that yet. So they're going to continue to look at that.
Yeah, because one of the things that I totally understand that they identified that wasn't currently identified in the budget. But I would think that salaries would be applicable if overtime hours were expended as a result to load out and or issue PPE to other county entities or other agencies within a municipality, and those type of things. But I totally understand that the finance committee can take a look at that. And obviously, does the state have an open communication set up so that they can get clarifications? And
Yeah, I believe they do through the auditor specifically.
Okay.
I think the auditor has a meeting coming up where they're going to try to clarify some of those things. But like the public safety salaries, they have to be specific. Those individuals have to be dedicated to the COVID crisis. It can't be just salaries based upon their normal operations.
yeah, because salaries would have been in the regular budget for the
Correct.
Okay. Well, thank you.
Mm-hmm.
Item number 15.
I am Pam Haverkos with Clermont County Emergency Management Agency Director. Item number 15 is a recommendation of Thomas J. Igle, County Administrator, to authorize Pam Haverkos, Director of the Clermont County Emergency Management Agency, to act as the authorized agent in and as it relates to the Federal Emergency Management Agency, FEMA DR 4507 OH Public Assistance Grant, and to authorize the execution of the state and local agreement with the Ohio Emergency Management Agency for and on behalf of the Board of County Commissioners for the provision of disaster relief funds for emergency protective measures relative to the COVID-19 event declared a presidential emergency on March 31st of 2020 for reimbursement of 75% of eligible expenses with a required local match of 25% for each 2 and 2 and in compliance with the terms and conditions set forth therein and in concert with the Federal Emergency Management Agency's Public Assistance Grant Program.
Board, you've heard the reading of item number 15. Do I have a motion for approval?
So moved.
A second?
Been moved and received a second. Any further conversation or discussion? Roll call, Holly.
Commissioner Humphrey?
Aye.
Commissioner Corcoran?
Yes.
Commissioner Painter?
Yes. Item number 16. Thanks, Pam.
Thank you.
Good morning. Item 17?
16.
16.
Is a recommendation to approve the establishment of the two funds regarding the local coronavirus relief fund and the county coronavirus relief distribution fund. The local one will be Fund 2008, and that will be distributed to the county based on the local government fund formula. And then the one that the county has already received as of yesterday, the House Bill 481 distribution, and it came to $3,224,735. That's where they will receive the money, the auditor received the money, and then they'll distribute it based on the local government fund formulas to the various jurisdictions as they pass their resolutions. This amount is actually about 11.6% more than the local government fund in 2019 was. So based on the local government fund formula, we should get about $1,565,000. So this motion is to establish the two funds, which is approved through House Bill 481, and ORC Section 570509.
Board, you've heard the reading of item number 16. Do I have a motion for approval?
I'll make the motion.
Second.
Been moved and received a second. Any further conversation or discussion? Just before we move on there, Mary, you said $3,224,735.
Yes,
That's a
and 79 cents.
79 cents. I forgot about that part.
I didn't say that.
And so, per the local government fund, how much will actually be distributed to Apple municipalities and?
The difference between 1,565,448
In the 3,224?
and the 3,224. We get about 48.5% of that. So 51% plus.
And that is in addition to what the local government fund will be for this year also,
Right, this is.
which we don't know that amount.
We do not know what that amount is yet.
Okay.
And this money will be going to them to spend, but as Tom said earlier, there are all kinds of restrictions and has to be spent by middle of October. It'll come back to the county, into this county coronavirus relief distribution fund. If it's not spent, then the auditor will redistribute it after holding some back for the county to the jurisdictions who did spend all of their money.
And I would just use a different term. Instead of restrictions, I would just say there's a lot of opportunities for being reimbursed.
There are a lot of opportunities. It is very broad. So there's a webinar this afternoon that hopefully will get some clarification on exactly what can and cannot be.
Understood, and that was the reason of my asking on that, was because after I had read that, I can only relate that to the American Recovery Act, and the same questions were asked about those monies prior to, distribution and actual, reimbursement for those of what constitutes the definition expenses. Because that was one of the things we looked at, because as companies, vendors, people spend money, there are other expenses in there. G&A is in there, and cost of overhead is in there, and people have to, if you're making a procurement for a particular item, that's not in your original budget, wasn't something you were going to buy. Well, can their time be related to that purchase? I mean, there's all of those questions there, that really need to be answered.
Right. Yeah, the
So-
staff time in particular is one that we need clarification.
And I would ask that those that ask those questions be persistent and drill down through that and pull the skin of the onion back and take a look at it, because in many, many instances when we ask those questions about recovery funds, the quick answer was, well, that doesn't qualify, and don't take that for an original answer. Really state your case and show how those costs are incurred and how they are accounted for. Because many times, they came back to that and said, well, you know what, after we really look at that, you're right. That's not a cost that you would have covered. When the first brush was always to just, nope, that doesn't qualify. That's my concern. My concern is there are legitimate expenses there that county governments will have incurred that people will not have thought of, that are related to that particular action or that particular expenditure.
And there'll be increased costs.
That's correct.
Where they would have spent X amount of dollars on something, but because of additional personnel or additional trucks on the road or something, the other costs.
Right, and the
are
other thing
increased.
is, what about the things that you pushed back that you're not going to incur in a year that it took up that time? Even though that person was in the budget, the work that was actually budgeted wasn't completed, if that makes sense. So just food for thought there, and think about it. Okay. Roll call. Polly?
Commissioner Corcoran,
Yes.
Commissioner Humphrey,
Aye.
Commissioner Painter,
Yes.
Thank you.
Thanks, Mary. Item number 17. Hi, Yvonne.
Good morning. How are you?
Good.
Yvonne Smith, Benefit Plan Coordinator for Clermont County, is my recommendation, with the concurrence of Sandy Tahat, Human Resources Administrator, to authorize the payment of the Patient-Centered Outcomes Research Institute, also known as the PCORI fee, to the Department of the Treasury Internal Revenue Service at the rate of $2.54 per person for the average number of members in the Clermont County Self-Insured Health Plans for calendar year 2019. The total amount is not to exceed $4,612.64, and to authorize Thomas J. Eigel, County Administrator, to execute and file the Department of Treasury Internal Revenue Service Quarterly Federal Excise Tax Return Form 720, along with the aforestated fee to be received by the filing deadline of 7/31 of 2020, pursuant to and in compliance with the Federal Patient Protection and Affordable Care Act, and contingent upon the release of the required purchase order in concert with requisition number 3462, dated 6/15/2020.
Board, you've heard the reading of item number 17. Do I have a motion for approval?
So moved.
I'll second.
Been moved and received a second. Any further conversation or discussion? Roll call, Holly.
Commissioner Humphrey?
Aye.
Commissioner Corcoran?
Yes.
Commissioner Painter?
Yes.
Thank you.
Thank you. Item number 18. Hi, Sandy.
Good morning. Item 19 is a recommendation of myself, Sandy DeHaat, Human Resource Administrator, with the concurrence of Thomas J. Eigel, County Administrator, to adopt a revised table of organization for the Clermont County Board of Commissioners as outlined in Exhibit A, attached thereto, made a part thereof. These changes revise the reporting structure of the departments under the board. It moves the Water Resource Fiscal Administrator from the board's table of organization to the Water Resource table of organization, and moves the personnel of the HR department to the HR table of organization. That would be effective upon approval, and to also authorize the update of appropriate internet links and appendices accordingly.
Board, you've heard the reading of item number 18. Do I have a motion for approval?
I will make the motion.
Second.
Been moved and received a second. Anything further? Roll call, Holly.
Commissioner Corcoran?
Yes.
Commissioner Humphrey?
Aye.
Commissioner Painter?
Yes. Item number 19.
This will be a recommendation of myself, with the concurrence of Mr. Eigel, to adopt a revised table of organization for the Department of Community and Economic Development, to remove the position of Assistant Director, classification number 89380, pay range D, as outlined in Exhibit A, which is attached as a part of this, effective today, and to further authorize the update of the appropriate internet links and appendices accordingly.
Board, you've heard the reading of item number 19. Do I have a motion for approval?
So moved.
I'll second.
Been moved and received a second. Anything further?
I would just point out for the board's information that the abolishment of the Assistant Director position would be a cost savings, and there's also a Development Specialist position that is vacant that's not intended to be filled. So overall, there's an estimated cost savings about $193,000.
Thank you, Sandy. Roll call.
Commissioner Humphrey?
Aye.
Commissioner Corcoran?
Yes.
Commissioner Painter?
Yes.
Thank you.
Thank you, Sandy. Item number 20.
Item 20 is a recommendation to designate Greg Bickford and Gail Foley to serve on the Tax Incentive Review Council during calendar year 2020 pursuant to Section 570985 of the Ohio Revised Code.
Board, you've heard the reading of item number 20. To have Greg Bickford and Gail Frawley to serve on the Tax Incentive Review Council. Do I have a motion for approval?
I'll make the motion.
Second.
It's been moved and received a second. Anything further? Roll call, Holly.
Commissioner Corcoran?
Yes.
Commissioner Humphrey?
Aye.
Commissioner Painter?
Yes. Item number 21.
21 is a recommendation to designate Commissioner Painter to serve on the Tax Incentive Review Council during calendar year 2020 pursuant to Section 570985 of the Ohio Revised Code.
Board, you've heard the reading of item number 21. Do I have a motion for approval?
So moved.
A second?
Been moved and received a second. Any further conversation? Roll call, Holly.
Commissioner Humphrey,
Aye.
Commissioner Corcoran.
Yes.
Commissioner Painter,
Abstain. Item 22.
Item number 22 is recommendation of Director of Office Management and Budget with concurrence of the County Administrator to adopt the 2021 annual tax budget for Clermont County and authorize the President of the Board to execute the rate schedule on the front of that pursuant to and in compliance with 570528.
Board, you've heard the reading of item number 22 for approval of the annual tax budget for Clermont County for the year 2021. Do I have a motion for approval?
I'll make the motion.
Second.
Been moved and received a second. Any further conversation or discussion? Roll call, Holly.
Commissioner Corcoran,
Yes.
Commissioner Humphrey,
Aye.
Commissioner Painter,
Yes.
Thank you.
Thank you. Item number 23.
Commissioner Painter, if I may.
Absolutely.
On Friday, March 6th, 2020, a petition for annexation was filed by Michael Manier, attorney at law, for and on behalf of Dennis Nichols as the designated agent for the petitioner, Charles Kabicki, LLC, and comprised of all or part of 7 parcels from Batavia Township to the village of Batavia. The petition was acknowledged by the board on March 11th, 2020, and a public hearing was set for June 3rd, 2020, at 11 a.m. at the Board of County Commissioners. The prosecuting attorney has reviewed all documentation received and has rendered an opinion which was disseminated to the board last Friday, along with 2 resolutions, one to grant and one to deny the annexation. Today is June 24th, 2020, and we are within the 30-day period for the disposition of this annexation.
Holly, I know the Board of Clermont County Commissioners received those recommendations and review comments, and has had an opportunity to consider those. I know that Alan Edwards is here from our prosecuting attorney's office today, and I would ask that you address the board as far as your recommendations and findings.
Well, Mike, are there any specific questions that the board has regarding the opinion that I have issued to the board? I would note, as usual, there are always 2 items which are really up to the discretion of the board, and that is whether the territory to be annexed is unreasonably large. I think I indicated in my opinion that I don't believe there was any testimony to that effect at the hearing. And the other is the general good of the territory and to be annexed in the surrounding area. The benefits outweigh the detriments of that. In my opinion, the other 4 sections, which are the more technical sections, were met. The one that was slightly different than we typically see was there was an issue raised as far as the adjacent landowner certificate, which was filed with the board, and Mr. Kellerman said that he was not listed on the certificate, and he was clearly an adjacent landowner. I would note for the board that pursuant to Section 70902D, specifically states that any error in the adjacent property list should not affect the petition for annexation. Also, I would note that I don't believe Mr. Kellerman suffered from that lack of notice because he appeared at the hearing with counsel, so clearly he had notice of the hearing. And thirdly, on that regard, Section 709.015 of the Ohio Revised Code states that any procedural defect in the annexation process is deemed to be cured so that it's not defeated on a purely technical basis. So I would point that out. That's different than what we've seen. That's usually just a matter of fact finding on that. But so I don't know if the board has any additional questions on anything.
Board members,
No questions?
any question or clarification?
No, thank you for that.
Thanks, Alan.
Yeah.
Then in accordance with item 23, I would recommend the Board of Clermont County Commissioners adopt resolution number 113-20, resolving to grant the petition for annexation of 157.2561 acres of land situated within Batavia Township to the Village of Batavia, Clermont County, Ohio, filed in the office of the Board of Clermont County Commissioners at 9:55 a.m. on Friday, March 6 by Michael Manier, attorney at law, 626 Main Street, Milford, Ohio, 45150. For and on behalf of Dennis Nichols, 65 North 2nd Street, Batavia, Ohio, as a designated agent for the petitioners Charles J. Kabicki, LLC, who is the owner of the described real estate sought to be annexed pursuant to and in compliance with Section 70902 of the Ohio Revised Code. Do I have a motion to approve the annexation?
So moved.
I'll second.
Been moved and received a second. Any further conversation or discussion? Roll call, Holly.
Commissioner Humphrey?
Aye.
Commissioner Corcoran?
Yes.
Commissioner Painter?
Yes. Thanks, Alan. And thanks, Holly, for item number 24.
Item number 24 is a recommendation to increase the annual appropriations for 2020 for the Special Election Fund for $38,035 and for the Workers' Compensation Program Fund in the amount of $1,368,900.
Board, you've heard the reading of item number 24 for appropriations changes. Do I have a motion for approval?
I'll make the motion.
Second.
Been moved and received a second. Any further conversation? Roll call, Holly.
Commissioner Corcoran?
Yes.
Commissioner Humphrey?
Aye.
Commissioner Painter?
Yes.
Thank you.
Thanks, Mary. That concludes our agenda as presented. Tom, are there, any additions to the agenda?
Commissioners, I have three for your consideration to add to the agenda. First is a personnel action in the Water Resources Department. Second is participation in the Ohio Unified Certification Program. And last is a resolution to rescind the request to advertise for bids for the 2020 road resurfacing program.
Board, you've heard the request to add 3 items to our agenda. Do I have a motion to add the 3 items just mentioned to our agenda for today?
So moved.
I'll second.
It's been moved and received a second. Roll call, Holly.
Commissioner Humphrey?
Aye.
Commissioner Corcoran?
Yes.
Commissioner Painter?
Yes. We'll take them in the order that you discussed them, Tom, with the personnel action first.
Okay, personnel action in the Water Resources Department, Gregory Farrow. He is a Operator 1 in the Water Resources Department. It's a termination resignation effective 6/19/2020.
Board, you've heard the reading of the resolution. Do I have a motion for approval?
I'll make the motion.
Second.
Been moved and received a second. Any further conversation or discussion? Roll call, Holly.
Commissioner Corcoran?
Yes.
Commissioner Humphrey?
Aye.
Commissioner Painter?
Yes. And the next one is the Ohio Unified Certification Program.
It's a recommendation to participate in the Ohio Unified Certification Program as it relates to disadvantaged business enterprise and the airport concession disadvantaged business enterprise certification decisions on behalf of all U.S. Departments of Transportation recipients in Ohio, and further to designate Thomas J. Eigel, County Administrator, as the authorized representative to complete and sign the commitment forms, thereby declaring the commitment of Clermont County a Federal Transit Administration and Federal Aviation Administration recipient to participate in the Ohio Unified Certification Program.
Board, you've heard the reading of the resolution to participate in the Ohio Unified Certification Program as it relates to disadvantaged business enterprise and airport concession disadvantaged business enterprises. Do I have a motion for approval?
So moved.
I'll second.
Been moved and received a second. Any further conversation or discussion? Tom, you want to just give us an explanation on that as to?
Sure. So a letter is received by First Transit, Clermont Transportation Connection, as well as our Clermont County Airport Operator, Eastern Cincinnati Aviation. They received a letter from the Ohio Department of Transportation on February 11th, 2020. And basically, if we are to receive any grants that would meet or exceed $250,000, we would have to be a participant in this program. Now, as you know, we have not received an FAA grant in quite some time for that amount of money. However, if we do in the future, especially for the airport layout plan, those are pretty costly. It could approach that amount, and if we are not a participant, we would not qualify for a grant for that money. Now, we haven't received $250,000 for our, from the FTA for CTC because buses aren't included in those grants. So that's the only big grant that we've received as for our transit buses. However, there's no downside to participating in the program. So we contacted ODOT and they said, yeah, there's no downside. So you might as well participate even though you probably won't receive an FTA grant in that amount.
Okay. Anything further, board? Roll call, Holly.
Commissioner Humphrey?
Aye.
Commissioner Corcoran?
Yes.
Commissioner Painter?
Yes, and then the next one is resending the request to advertise for bids.
Suki?
Right, we've got a recommendation now to resolve to rescind the request to advertise for bids. This is for project number 111651, relative to the 2020 road resurfacing program phase 1 that was in various townships. The board ratified this last week. The reason we have to rescind it is we are still pending approval from the Ohio Department of Transportation to advertise for this bid. Hopefully, by the time we have session again the week after 4th of July, we will have that, and we will then be able to set the advertisement dates and the bid opening date.
Board, you've heard the reading to, on the resurfacing program to resolve to rescind the request to advertise for bids. Do I have a motion for approval?
I'll make the motion.
Second.
Been moved and received a second. Any further conversation or discussion? Roll call, Holly.
Commissioner Corcoran?
Yes.
Commissioner Humphrey?
Aye.
Commissioner Painter?
Yes. And Suki, before you get off, if you're still there, one of the things I would just ask on that is it ODOT's approval of the specifications for the pavement that seems to be the holdup? And
I think they've already approved the specifications. Because there's federal money coming from this, ODOT has to get approval from the Federal Highway Administration also to advertise for the advertisement. So they pretty much review the entire bid package.
Okay. Well, and the concern there is obviously, the more summer days that are burn up, the tougher it gets, backing up to the asphalt plant schedule to actually be able to, commit these kind of dollars.
Right. This actually is fiscal year 21 funds, but by the time we probably get these bids out and back and contract awarded, we're looking at August. We know that. We may have to extend the completion date of this to carry over into the spring.
Okay. Well, thank you. Any other additions to the agenda, Tom?
No, sir.
Okay. Then I will move to H, executive session. I'm requesting an executive session pursuant to section 121.22G1 and G3 of the Ohio Revised Code to first consider the appointment, employment, or compensation of one or more public employees, and second, to confer with the prosecuting attorney regarding pending or imminent litigation, respectively. Do I have a motion to move into executive session?
I'll make the motion.
Second.
Been moved and received a second. Roll call, Holly.
Commissioner Corcoran?
Yes.
Commissioner Humphrey?
Aye.
Commissioner Painter?
Yes, we will move to executive session. We will return and we will conduct further business. Thank you. Session, there were no actions taken and no decisions made, and we will move on with our agenda. We covered I previous to this, but I will cover it again. Are there any county staff, elected officials that need to make a discussion to the board? Okay.
Sorry, can you start?
I will. Good. We are back from executive session. There were no decisions made and no actions taken. I'll move on with the regular agenda. I is for county staff and elected official discussion. We've previously covered this, but Tom, is there any other elected officials or staff that would like to address the board today?
Yes, sir.
Okay, then I'll move on to J for member comment. Board members, any comments today about today's meeting?
None.
Just we need to reemphasize probably what Julie said. We need to mask and social distance and not let our guard down, and hope everybody can do that. I see an awful lot of people in the public that aren't wearing masks.
And before before I ask to motion to adjourn the meeting, I'd just like to say again that we'd like to thank the Simmons family. Obviously, it's an emotional time for them. It's an emotional time for me. I've known the Simmons family for over 50 years. I didn't mention that Russell is survived by his 5 daughters and obviously his wife Barbara. We just like to say thanks for Russell's service to Clermont County, and that our prayers are with the family during this difficult time. Thanks for sharing him with us. Any other comments, board?
Thank you.
I would ask for a motion to adjourn the meeting today.
I make the motion.
Second.
Been moved and received a second. Roll call, Colin.
Commissioner Corcoran,
Oh, sorry, yes.
Commissioner Humphrey,
Aye.
Commissioner Painter.
Yes, that concludes our meeting for June the 24th, 2020. Thank you for attending today, and we'll see you next week.